My name is Teshome Gebre. I'm presenting on behalf of a study team, which was led by Dr. Ismail Haptamu, and members include Mr. Fikra Seifa and Professor Wundimagi Mbele and Mr. Bahailu Magdokios, representing the different institutions. Next, yeah. So this is an overview of the study or my presentation. As introduction and background and study location, research questions and objectives, methods and lessons learned, and implications for policy practice and future research. And finally, I will say a few words on summary of key messages. Now, talking about the background of of this study, as most of you understand, Ethiopia is the highest burden country for NTDs, and NTD interventions in Ethiopia are primarily dependent on external support, with limited support, with limited integration into the health system. And as again, all of you know, we have the new WHO NTD roadmap, which propose mainstreaming, and also in Ethiopia, we have developed the sustainability action plan for NTDs. Again, in that it is proposed mainstreaming and integration of NTD control into the health system. So as we venture into this study, there are some gaps that we need to really appreciate. One is there's no adequate evidence on how to implement mainstreaming in real life, real world setting. And second, mainstreaming can be detrimental, as you know, to a weak health system, which may be the case in most situations. And evidence needed again on capacity and preconditions needed for integration. So these are the study areas, and this study covered about 8 regions, and the 8 regions are literally very highly representative of the national population, the national, be it geographically, be it in terms of population, it is a very highly representative study. When it comes to research questions, and objectives, our main research question was what preconditions and strategies facilitate mainstreaming of NTD activities into the PHC system in Ethiopia. And the objectives, again, are assessing operational capacity and readiness of the Ethiopia PHC system, and based on that, developing acceptable, feasible strategies to partially or fully mainstream NTD campaign intervention into the Ethiopia PHC system. The methods that we used include, it's just a mixed method exploratory implementation research. And we have 4 phases in this. The first one is review of existing mainstreaming practices, is literature research. The phase 2 is stakeholder consultative workshop to just discuss on mainstreaming practices and available evidence and knowledge. And then phase 3 was data collection on health system capacity, readiness, and assessment. And the final was co-development of mainstreaming strategy with stakeholders. Now, what were the tools that we used for this study? One is a PHC capacity and readiness assessment, and the second one is a consolidated framework for implementation research, which is we call CIFIR. And the third one was the modified readiness for organization change, which is again assessing readiness of PHC workers for change. And the last one was primary healthcare performance initiative, HCPI framework. And when it comes to the study design, you can see the distribution. Now we had at national level, we collected data from the NTD and primary care workers and finance department and logistics and supplies, and the implementing partners and funders at the national level were also interviewed. When it comes to the strata, now we have 5 strata next to the region, next to the national level. First strata is regional level. We had 8 regions, and then the second strata consists of 10 districts, and the third strata is consisting of PHC facilities that are 30, and the fourth strata is health posts, and there are 90 of them. And at the 5th stratum is the community itself. And so the study data was gathered from all these levels. And using again the PHCPI system, the PHCPI framework, we tried to look into the PHC capacity, and we looked into first the system, and under that we came across in that the fact that NTDs are incorporated into the national healthcare policies. This is one thing very encouraging, and there was inadequate involvement of political leadership in the governance of NTDs. This is a little bit of concern, and NTDs are not often discussed in the management meeting of PHC facilities. This is another issue. And there is no budget lines, strictly allocated for NTDs in most regional health departments, health bureaus, and district level health facilities as well. And NTDs constitute only about 0.08% of the total domestic expenditure for healthcare. This is again a very worrisome and concerning issue. Again, using the same PHCPI framework, we looked into the inputs at the PHC facility level. Workforce availability and distribution was inconsistent across levels, and no sufficient availability and distribution of NTD drugs and supplies across facilities. When we looked into the service delivery, at least for morbidity management and disability prevention services, these were not really available, and in most facilities. Overall, NTD service availability at the health facility, at the service delivery, the delivery level was about 32%, and the majority, 80% of this, 80% of the interviewed participants support the mainstreaming of NTD campaign interventions. This is a very big plus for this exercise. However, majority again believe that it's only partial mainstreaming that is possible for MDA and MDD at this point in time. So this is a graphic presentation of the PHC workers' readiness for change, and as you can see, close to 80% on average are very much supportive, and this is a very encouraging finding when it comes to the readiness of the PHC workers for NTD campaign intervention mainstreaming at all levels, as you can see. And what are now the implications of these findings for policy and practice? First, there is very limited government financial contribution, direct contribution for NTDs involvement, and also involvement of NTD governance system at all levels may hamper mainstreaming efforts. This is one big concern that we have and that we came across. And there is insufficient availability and distribution of NTD drugs and supplies across facilities for the routine or regular health service delivery. And PHC workers' willingness and readiness for change. This is really very encouraging one, and you have seen it in the graphic presentation as well. So the conclusion that we came across was partial mainstreaming of NTD campaign interventions would be possible at this point in time, and that can be done in a scaled manner gradually as we transition from partial to full mainstreaming of NTD campaign interventions. So what are the implications for future research? One is to look into the system inputs and service delivery gaps that need action prior to embarking on mainstreaming of NTD campaign interventions. And the second and most important one is we need to conduct implementation research to pilot and then scale up the national NTD campaign interventions mainstreaming strategy. And now, just in a form of summary, based on the primary health care performance initiative framework, we have summarized the findings into the 3 areas of system inputs and service delivery. When it comes to system improving the engagement of the political leadership in NTD governance, that is very important, and increasing government's financial contribution in terms of direct budgetary allocation at all levels. And the third one is development of national strategy and implementation guide for NTD campaign mainstreaming. These are the 3 key summary with regard to system. The second one is in terms of inputs, again, both based on this page CPI framework. We will need to enhance equitable workforce distribution and capacity, and again, enhance effective drug supply chain and management system at all levels, and also improve health facility and information system infrastructure. When it comes to service delivery, we will need to improve recording and reporting, so DHIS2, and of course, there is very encouraging workforce willingness and readiness for the mainstreaming of NTD campaign interventions. But we need to sustain this through good governance and motivation, as well as by doing regular supportive supervision and monitoring. So these are the steady participants or participants of the stakeholder workshops. And at the end of the day, we just would like to acknowledge the support that we received for this study. First of all, the funding organization, Bill and Melinda Gates Foundation, through the Health Effectiveness Program, Health Campaign Effectiveness Program Office of the Task Force for Global Health, and other partners include the Ministry of Health, Mammoth University, and steady participants at various levels, and of course, all research team members. So thank you very much for listening.